The product came with impressive packaging and an aggressive claim. Creatine in liquid form, stabilized through proprietary technology, absorbed faster and more completely than powder. The company charged a significant premium for this stability innovation. Clinical testing then produced results that directly contradicted the claim. Creatine Serum, a category of liquid creatine products popular in the early 2000s, represents a case study in how a plausible marketing premise can survive direct clinical refutation through product persistence and continued consumer interest in novelty. The story is worth understanding in detail because it illustrates how supplement categories can sustain themselves despite evidence. The serum category's central premise was that creatine could be stabilized in liquid form through pH optimization and proprietary additives, allowing it to remain as intact creatine rather than converting to creatinine during storage. The advantage claimed was absorption. Liquid creatine would reach the bloodstream faster and in higher concentrations than powder-derived creatine, producing superior muscle loading. Head-to-head testing demolished this premise. Studies by Gill, Hall, and Bott, published in peer-reviewed journals in the mid-2000s, directly compared creatine serum to creatine monohydrate powder in resistance-trained individuals using standardized supplementation protocols. Muscle creatine content was measured via biopsy. The results were unambiguous. Subjects supplementing with creatine monohydrate powder showed significantly greater increases in muscle creatine content than those taking creatine serum at equivalent doses. The proposed explanation was consistent with what chemistry predicted. Liquid creatine, despite the proprietary stabilization claims, contained significant creatinine by the time subjects consumed it. Independent analysis of commercial creatine serum products found that the ratio of creatine to creatinine in some products was far lower than the label implied. The stability problem that the serum category claimed to have solved had not, in fact, been solved. Creatine serum products continued to be sold after these results were published. Product formulations were adjusted and reformulated. Marketing language shifted from explicit efficacy claims to more general language about convenience and palatability. The category shrank, but did not disappear. The serum episode has practical relevance beyond its historical interest. It established a principle that remains applicable to evaluating any liquid creatine product. The claim of stability must be demonstrated through independent measurement of creatine content at the end of stated shelf life, not merely asserted by the manufacturer. Internal stability testing under controlled conditions is not the same as independent verification of what consumers actually receive. For any athlete evaluating liquid creatine in any format, serum, ready to drink, shot, the question to ask is not whether the manufacturer claims stability, but whether independent analysis has confirmed creatine content under real storage conditions. In the absence of that confirmation, the default assumption based on what chemistry predicts is that meaningful creatinine accumulation has occurred. The cost argument adds a practical dimension. Creatine serum products commanded prices several times that of equivalent monohydrate doses. For a compound that delivered less creatine per dose, the value proposition was negative by any reasonable calculation. Powder dissolved fresh in water produces no creatine degradation between mixing and consumption. Liquid products that claim to solve a stability problem they have not actually solved cannot justify a premium over that alternative. The broader lesson from creatine serum applies to evaluating any supplement category claim about novel delivery technology. The test is not whether the technology sounds impressive, it almost always does, but whether the technology has been validated against the most important downstream outcome. For creatine, that outcome is muscle phosphocreatine saturation after several weeks of supplementation. Absorption kinetics, blood concentration curves, and in vitro stability data are all mechanistic steps on the way to that outcome, but they are not the outcome itself. Several products in the broader supplement market use the same pattern. Establish a plausible mechanistic rationale, market on that mechanism before clinical validation, continue selling after the mechanism fails to translate to the predicted outcome. Creatine serum is one of the cleaner examples because the clinical testing was done rigorously enough to produce unambiguous results, and the results were unambiguous enough to definitively answer the question.